If you're one of those people that just wants to know why your back pain just won't go, even though you've had treatment for weeks, months, years, then I want to talk to you today, because our office is quite often the last stop shop for many people who have tried everything, been everywhere, and my team with their expert knowledge is sometimes called upon in these situations. So this is quite often what we see more frequently than not with people who have had back pain, is these chronic people who just haven't had resolution in any way, shape or form. So I want to share some experience with you that we've had in our office amongst my team about how we go about managing these things and the key things that we see that stop people from getting better even with treatment. Okay, so the first thing, which is probably the biggest thing that we see, is lifestyle issues. And when we talk about lifestyle issues, we're talking about things you do every single day that you may not realize that are creating your problem. So top of the list are mattresses that don't support properly. Now, this doesn't mean you need a mattress that's firm, that's $5,000 or anything like this. These are just mattresses that don't provide quite enough support or are too soft with the pillow top or toppings, that our pelvises sink a little bit too far in it, causing muscular contraction all night. And we see this as a recurrent reason why we see strain patterns through core musculature in these patients. That just happens recurrently despite training, despite fitness work, despite treatment. It just happens over and over again. We see a similar thing with people who are using couches, where they lay sideways on the couches, leaning with their elbow up and bending sideways like a banana, and their pelvis sinks into a couch. So lack of support is a big, big problem that we see with these people that cause these strain patterns to come back. The second one is chronic inflammation. And this is missed by a lot of musculoskeletal therapists because it's somewhat outside their scope of practice to a great extent. So we're talking about inflammation. Inflammation is a good thing. It helps you recover. It helps you regenerate. It helps you heal. But after a period of time, it no longer serves that purpose. And this is when we start calling it chronic inflammation. And the problem we have with chronic inflammation is that chronic inflammation basically just accumulates, it creates scar tissue, it creates adhesions, and it creates problems. And these people quite often will feel that stiffness or achiness first few steps, first thing in the morning. And the number one way to resolve that is to regulate dietary patterning, for which you need to have an understanding of nutrition and biochemistry for that matter. So when we have an elevation of carbohydrate, for example, in our diet, or a high GI-based diet, we tend to increase insulin, which alters our fatty acid ratios, producing prostaglandins, leukotrienes, and other similar agents to this, which creates pain, inflammation, and also can play havoc with healing. So that's the second one, is controlling inflammation. The third one is poor gut health. As strange as it sounds, yes, the gut can refer pain, can refer problems to the back. There are certain muscles that we've observed over the years that seem to switch off. And if you have a look at all my previous videos on iliocecal valve dysfunction and the correlation between that and back pain that we've seen, you'll see a whole lot of information related to how gut function can affect the back. The fourth one is food sensitivities, in particular one type of food sensitivity, and we don't see it overly commonly, but it does happen, and that is sensitivity to nightshades. Now, nightshades have a protein called a glycoalkaloid, and when this glycoalkaloid gets into the system, if you are one of these people that do absorb them, they tend to play havoc. They tend to either inhibit the parasympathetic system or stimulate your flight or fight system. And when that occurs, we commonly find that people get inflammatory type reactions in the sacroiliac joints. So these people develop one-sided low back pain quite often. It seems worse when they're sitting down, especially if they're in front of a computer doing work. And sometimes it can lead to radiating pain down the leg as well. It's not an overly common thing, but it is one of the reasons that we do see recurrent sacroiliac one-sided low back pain happen in these people who just fail with standard treatments. And the final one is poor technique. Now, when I talk about poor technique, we could go to sleeping techniques, sitting techniques, driving techniques, all these type of things. But what I'm really talking about is activity-based technique. In other words, how you play your sport, how you do gym, these type of things, your running style. These are really, really critical and can play huge problems and create enormous issues with people trying to recover from injury with back pain, or even in generating back pain themselves. And unless someone who is trained in running technique or in that sport, who understands biomechanics, movement as it relates to back pain, views you and sees your posture when you're doing those type of things and interprets it correctly, then this can be a recurrent source of problems. And this is a big issue that we see as well amongst a lot of athletes, where we see some practitioners that work with athletes aren't trained in that sport and aren't trained in biomechanics very well. And likewise, we see this with coaches and the like who have all the answers but don't understand how that relates to their injury. So this is where our team has spent a lot of time researching, getting educated in a lot of different sports and a lot of these different areas, including biochemistry and nutrition, simply so that we can put all this together and get to these chronic cases and really make a difference in these people's lives very, very quickly. Anyway, guys, so they're the five top reasons, the 5 top reasons why I see that patients really struggle with care, who fail with care, despite having all the best of treatment they can provide. So if you have any questions or if you're concerned about your situation in particular, please just post up below. My team's always here to help you, or don't be afraid to message me. I always get back to people very, very, very quickly. So please don't be afraid to do that. Anyway, I'm Trev from SpineWise, and we'll see you in the next vid. Bye for now.